Hello to all of you. I'm Karen Higgins, CFO of Cooperators, and I'm really thrilled to be able to provide you with an update on our mental health initiative. But first, let me tell you a bit about our organization. Cooperators is a leading Canadian financial services cooperative, offering multi-line insurance and investment products. We've been providing service and personalized advice to Canadians for over 75 years. Our goal is to provide Canadians with financial strength and security. As you can see, we have over $60 billion in assets under administration and employ over 7,000 people across our offices in Canada. What sets us apart from many others in the insurance and wealth management spaces is how intensely we focus on the betterment of communities across Canada, and from that, how deeply we embed sustainability into our operations, strategy, and decision-making. A lot of this philosophy is informed by our deeply ingrained values. As a leading cooperative, helping others is how we do business, and that means embracing responsibility, integrity, and inclusion in everything we do. Part of our cooperative identity and mission involves looking for ways to address unmet needs in Canadian communities. So given the alignment with our expertise and insurance line of business, I'm sure you can understand the mental health initiative of A4S was a perfect fit. In my own role as CFO, I'm responsible for helping the organization strike a balance between strong profits and the best interests of Canadians, ensuring that we can deliver on our cooperative promises and our social and environmental initiatives. When sustainability is so often sacrificed for the purpose of profit, I truly believe the work we are doing here is transformative and vital. Cooperators originally agreed to join the A4S initiative in 2016, compelled by the mission to champion proactive mental health practices for our employees, clients, and communities. The first steps in our efforts was establishing the business case for the mental health initiative and how it might generate value for our operations through the lens of social, financial, and human capital. From a value creation perspective, the intent of the mental health initiative was to add value over the long term in the following key areas: providing value-added mental health benefits to our clients with a specific focus on our group benefits line of business, improving staff wellness and engagement and creating social value for both our staff and our communities, and reducing costs and claims related to mental health concerns. In Canada, where Cooperators operates, 1 in 5 will experience mental illness every year, nearly half of whom will not seek treatment or support, a very concerning gap and unmet need. And we could see both in terms of our own employee tracking and that of our group benefits clients. The rate of long-term disability leaves due to mental health illness were increasing. A strong link can be drawn between a mentally unhealthy workplace, work-related stress, and an unhealthy lifestyle. Over time, unhealthy workers and workplace practices take their toll and can lead to a host of outcomes, including mental illnesses such as depression and anxiety. The cost of doing nothing has no ceiling. Yet the fact remains, good health leads to good business. Canadian and international studies have shown that a mentally healthy workforce is linked to lower medical costs, lower absenteeism, and higher productivity. While assessing the costs associated with our clients' mental illness was simple enough, we had to design new models and analysis for assessing the cost benefit for our own employees. This meant quantifying non-financial benefits, the human and social capital, and that in itself was a process. Being able to quantify was essential to tracking and proving that improved mental health outcomes would translate to financially related benefits. We set to work coming up with new estimates and calculations to inform the proposal, such as estimating productivity impacts of mental health and analyzing our historical data on short and long-term disability. By mapping this against our business operations and areas of expertise, we developed impact pathways to inform what steps we ought to take and what value might be generated in return. This work very clearly laid out our strategy for the road ahead and informed our implementation. We divided the work into 4 unique work streams. As we were in untested water, each work stream was designed to operate with agility, able to adjust their goals and objectives as we progressed and found out new things. Our workplace stream was about culture building, ensuring a positive environment, enabling employees to be their best selves at home and in their community. The client engagement stream was about client well-being, ensuring that we were providing products, services, and programs that would facilitate better outcomes for our clients and their mental health needs. The stakeholder engagement stream was deeply rooted in our cooperative values and identity. It was about ensuring that we built networks in our workplace and our communities that would support mental health. Through these efforts, we hope to catalyze change through partnership, education, advocacy, and research, and support those people who are most likely to be underserved despite often having the most intense need. And lastly, we have the communication stream, which served to support these 3 other streams by advancing awareness, education, and building reputational leadership. We also developed new tools and reporting cycles to help us effectively assess how well these work groups were progressing. This included pulse checks on resource adoption, engagement with our educational offerings, and online communities to assess leadership and employee capabilities. Quarterly reporting on medical leave and sick days to assess cost-benefit outcomes, and we benchmarked our employee mental health and use of counseling services in our group benefits offering to see if we could achieve a leadership position and catalyze others to follow our example. Within 6 months of implementing our mental health initiative at Cooperators, we were derailed. The world had come to a standstill due to the COVID-19 pandemic. According to the World Health Organization, anxiety and depression increased by a whopping 25% in the first year alone. And no wonder, when faced with the increase of incidents and deaths, the isolation of those early lockdowns, and a global cultural backdrop of mistrust and fear, we were facing a mental health crisis, and our initial strategy, designed for incremental improvements, would no longer pass muster. Tactically, we had to shift, but our motivation had doubled. The insights and reporting systems we had laid out in our early planning allowed us to pivot quickly. We refocused our efforts on establishing hybrid and remote work models and supporting our employees' mental health during this crisis, both of which have since proven instrumental in our ongoing journey. So, what did we do? It's been 5 years, and in that time, our workplace group has successfully implemented mandatory training for all people leaders to ensure they're equipped to help team members with the appropriate supports and maintain a culture that prioritizes mental health. We secured certification at the Platinum level by Excellence Canada, an award which specifically assesses a sound systemic approach to a psychologically healthy and safe workplace. It ensures that continuous improvement is a way of life with full integration of mental health into our culture and systems. It ensures that there are sustained results in all related areas, and that the organization is viewed as a leader in terms of knowledge sharing, industry and benchmark leadership, and best practices related to mental health in the workplace. The client engagement team added mental health conditions to the list of services for second opinion consulting. We offered through WorldCare International, a leader in global e-health services and solutions delivering highly specialized and personalized electronic second medical opinions from the best medical centers in North America to local attending physicians for the benefit of their patients. We enhanced our group benefit product to add internet cognitive behavioral therapy as a standard covered service as part of our insured paramedical product. And we also introduced cognitive behavioral therapy as part of the rehabilitation for mental health disability claims. On the stakeholder engagement side, we have developed new partnerships, such as Kids Help Phone. We launched an online mental health social group for employees to connect, discuss, and share resources and support tools, articles, and podcasts, empowering them to build a community of peer support. And in addition to executing supporting tactics for all other streams, our internal marketing and communications, social media, media relations, and communication teams have continued to spotlight mental health awareness via our internal communication channels to help reduce stigma, improve awareness, and highlight available resources. Over 95 articles were shared throughout 2019 through 2024, focusing on various health and well-being topics. Before I continue to discuss the achievements and KPIs for our mental health initiative, I'd like to emphasize that mental health is a complex issue. There are numerous systemic, external, and internal factors at play. It's also been a very volatile 5 years. So even as we compare quarter over quarter, these aren't always apples to apples. We have found a lot of room for interpretation when we look at just our own numbers. One of the reasons I'm so proud to be part of A4S and why I'm so pleased to present our results to date is that it is only by comparing across our organizations that we can truly find and identify patterns and define success. Coming back to our mental health dashboard, these are the items we are tracking and our own OKR. Our leadership and employee capability tracking has really been a sea of green. Over 96 content pieces has been published on our website, internet, and social channels discussing mental health and associated supports over the past 5 years. Our online community has been joined by nearly 1,600 employees who are sharing resources and authentic conversations about mental health. We've seen increased use and access of our employee assistance partner, which provides free and confidential advice and support for life's everyday issues. Support is available through confidential counseling, consultations, community referrals, multimedia resources, and online access to hundreds of articles, interactive tools, podcasts, calculators, and more. Because culture is built from the top down, we have implemented mandatory training and education for all people leaders. And we're seeing the value of this in our polling as employees are increasingly reporting respect-based relationships with their supervisors and the positive impact on their mental health at work. For our cost-benefit outcomes, we're seeing a persistent relationship between them, but it hasn't always been a direct. Shown here are two graphs. The top graph shows the quarterly duration of disability leaves, and the lower graph, the incident rate between Q1 of 2019 through to the end of Q3 of 2023. The dark blue line presents mental health versus total medical leaves. We saw a decline in duration of leave between 0.8 to 0.7, which tells us that we're getting the right help to the people that need it and helping them return to being productive at work. In the lower graph, you can easily visualize each time we experienced a COVID-19 wave and a clear correlation with mental health leave. For those first 2 years, we saw a gross improvement in leave incidents. Mind you, this was during a time when the WHO forecasted a 25% increase in anxiety and depression. Most recently, we have seen our incident numbers creep back up, which is also reflected in the amount of time employees are taking as sick days. So why is that? Well, we believe there are a few possibilities. First, ongoing global volatility and increased economic pressures. Our communications and culture work have been highly effective, so our employees are more aware of their rights to sick days and feel safe to use them without risk of stigma. The return to normal. Frankly, we get sick more often now that we're not isolating. We were less likely to come to work when we are sick, and sick days may well have been underreported when we all worked remotely. We also suspect that even though we never eliminated jobs for this reason, and we have always supported our employees' short-term disability leave, they may have feared repercussions in a time when record high unemployment rates were very prevalent and are only now getting addressed. But what I can say is that these were never conversations tabled at the executive level before this initiative began. So even though we intuitively knew these measures would be the slowest to change, we are seeing buy-in. We're seeing increased empathy, and speaking for myself, I know it's made me a better leader. I'm better able to hear them when they ask for help. I'm better able to support them. And I'm better at checking my own bias in these situations. I believe this mindset is why our mental health survey has found that our top strength is that our employees feel treated with respect. That said, the overall mental health index has been holding steady in the 77 to 80% range. So in 2023, we transitioned to a new quarterly pulse provider instead of an annual index. This will support faster access to results, action planning, and a closer view of what is impacting wellness. In summary, the highlights for me are that we have been able to very effectively and quickly create resources which support our employees and how our employees are engaging with these. The fact that we have enhanced our mental health benefits not only for our employees, but also our clients. That we are building our expertise and developing a more sophisticated analysis and understanding of mental health and its impacts on our company with what is really a rapid rate of learning. And the fact that we have earned external recognition tells me that even though we are still laying the foundation, we're on the right path. In terms of our next steps, we're focused on increasing awareness and use of existing products, such as our EAP and TELUS Health. We're also reviewing some of our tracking and reporting cycles to get a clearer view of the trends. But I can tell you we're staying the course and continue to invest in our clients and employees with expanded mental health coverage and new therapeutic streams targeting underserved audiences. I emphasize again, mental health is complex and the external environment is volatile. It's only by sharing our learning across organizations that we can establish a true best practice for supporting mental health sustainable accounting practices. Thanks for your time. I hope our story has been informative and helpful for your own planning.